So here we are, the January 19th meeting of the Board of Health, and most of us are here, and I expect Noreen will be along pretty soon. And apparently we have a guest, Nate Hurd. So Nate, if you want to unmute yourself and tell us your story, go ahead. Not hearing anything yet. Well, maybe Nate doesn't actually want to talk to us. Maybe he just wants to listen in. If he does want to talk to us, he'll figure out how to do it. Why don't we get started on the agenda? Can we have approval of the minutes of last meeting? Did I send them out?
Yes,
I don't even
you
remember.
did.
You did.
Okay, are they okay?
Yeah.
I
Yeah.
didn't leave anything out or put anything extra in? Okay,
Not that I picked up.
okay. Well, let's take them. We've got a septic system repair that's been kind of hanging around. It kind of slipped under the radar for me, although I can't imagine that's a problem because I don't think they could be working now anyway. But it's for 260 Leverett Road. Everything's in line. I don't have a signed application. I don't have a check, but I'm expecting those things soon. So with your agreement, I will just, when I get all the pieces together, I will just go ahead and issue that permit. Okay,
Move to
Sounds
approve.
good.
Agreed.
okay,
Agreed.
all right. So I will issue it when it happens.
Hey,
Another member.
oh my God.
So, Arlene, what can you tell us about the current situation and how things are going?
Well, the last few days have calmed down nicely. Cross my fingers on that one. I crunched a few numbers before tonight's meeting.
Yeah,
In the time since the beginning of the pandemic, we have had a total in Shutesbury of 113 cases of COVID. In the last 1 month, going back to December 20th, we have had, that I know of, 69. So,
wow. So more than half of them have been in the last month.
well, more. 69 of our 113 have been in the last 1 month.
Wow.
Of those, 52 are recorded in Maven. That is, they were reported test results or test results reported to DPH by the testing facility. And another 17 were home tests that were self-reported by the individual or their parent. And I suspect that there are many more of the latter category that I don't know about.
Yeah.
And home tests did not become a commonly done thing until fairly recently. So I think that that proportion of our total, you know, it's even greater than what our 69 out of 113 represents.
Undoubtedly.
Yeah.
Yeah, for sure.
Yeah. Yeah.
Right.
So that's what I have.
Wow.
And so I have taken advantage of DPH's current guidance for contact tracers is a couple of aspects. Number one, that in terms of formal contact tracing, that is getting a list of names of an infected person's close contacts and reaching out to every one of them and informing them and giving them guidance. For many, many communities, it is not feasible to continue to do that level of work. And so they have said that depending on a community's resources, we should prioritize as we see fit, and the priorities ought to be in situations where there's a high level of risk for exposure to groups. So a group living situation, a long-term care facility, a nursing home, a school situation, other places where a cluster is apt to happen. Those should be our priority on doing the detailed contact tracing. And where there is not that sort of risk, allow infected individuals to notify their own contacts and tell them what they ought to be doing. And so I have taken advantage of that and not been doing the case by case listing of close contacts and their notification. And that seems to be almost everyone I speak with says, I have notified everybody I've been in contact with and they've all sought testing, and that keeps me happy. And I hope
For
that's
sure.
okay with the rest of you.
That sounds great, actually.
Yeah. And I guess yeah, I think that's all that I have to say. So if anyone has any questions, holler.
You said there were two things.
Oh, sorry. Did I?
Yeah. And I don't know if two
It'll
things
come back to
were
me.
okay. I don't know if two were somehow in that
Yeah, maybe
thing,
they were.
or okay.
Okay. Oh, I
Okay.
know what the other one was.
Uh-huh.
And that is that I would encourage that we continue to get the word out that if people do test positive on a home test, to encourage them to let me know so that I can make sure they've got accurate guidance
Okay.
and that they get any assistance that might be called for in terms of contact tracing.
Okay. Okay. So you think another outgoing message would be
Well,
to the point?
yeah, I mean, especially since this whole eligibility for home tests free sent to your home has gone out. I know those aren't going to be shipped any day real soon, but home testing may become the greater part of what happens over time. And I know people are really hard pressed to find an appointment for a test. Otherwise, I've heard from people who had an appointment at CVS for a test and they went there and no one was there because of the snowstorm. And you know, there's all sorts of hardships about finding a clinical test right now. So the home test may become the default scenario as opposed to the you know, it may become the rule rather than the exception, I think.
And what about the other testing venues like UMass and Holyoke Community College and those places? Are they're still operating?
Yes, but I don't know how. I haven't recently heard. I know that there was a holiday weekend where it was closed, and but since yesterday and today, I have not heard from anyone about failures in that department, but I know it was a hardship over the holidays and over this recent 3-day weekend.
I heard today that UMass distribution sites for testing are now limiting, they're now handing out one per customer. It used to be you could grab a bunch.
Yeah.
That's no longer the case. One per customer.
Okay.
And
that's not a thing that you need an appointment for, right? You just go in and get the test and either take it there or take it elsewhere.
Correct.
But
you're not encouraged to swab on site.
I see. And so they're not encouraging what's the word, observed tests.
They don't.
No.
Yeah, no, that is not an observed test situation.
Okay.
Even if you ask for observation,
they won't do
for
it.
Picking up one of those kits, that's not available.
Okay.
You do it on your own and you drop it off.
But it is a PCR test.
It is.
Yeah.
Okay. Okay.
So I think the topic of testing and self-test and reporting to Arlene through the new email address would be a perfect thing for the newsletter. We've already put that out through the Board of Health notifications.
Remind me when the newsletter is printed, Kat?
Well, it's the submissions are due on Friday.
Right, but when is it issued?
Actually, let me see if I can figure that out. There's a fairly long delay. That's why I don't like to get too involved in details.
And the only reason that I say that is that Noreen and I were at the emergency preparedness team meeting. Was that last week, Noreen?
Noreen, you are muted, I think.
And the subject did come up about the degree to which the Board of Health notification reaches the majority of households, and some people on the emergency planning team said that they don't get it. So I think certainly reiterate it in the Board of Health notification, and let's also put it in the newsletter.
Mhm.
Okay. I don't know when it's going to be printed, but it seems to me that it takes at least a couple of weeks for the newsletter to be assembled and printed.
Mhm.
At least. I mean, I can check that with Linda. She'll probably have a better idea.
Mhm.
Grace joined briefly moments ago, but she's not on now.
She left again? Okay. Maybe she'll come back, or maybe it was a mistake. Okay, so let's go back to the newsletter thing again. Garrett, would you say again what you said before, so I make sure I get it down?
So when Noreen and I attended the emergency planning team meeting last week, we had mentioned the information that we were putting out in the Board of Health notifications that go out through the, what's the name of the system that does the communication? Is it
On the town announce?
Town
Is that what we're
announce,
talking about? Okay.
and some of the emergency planning team members mentioned that they weren't aware of the Board of Health notifications that were going out and only recently learned about them. And I don't remember what Grace said about the number of people who are signed up on Town Announce and then specific committees. But she said it's a fraction of households. And so that, including it in the newsletter, I think is an important option.
Right, I totally agree. And last time, it seemed to me that last time things were changing so fast we didn't put any substantive information, but we said, sign up for the newsletters, get on Town Announce. And I don't know if that had any effect. So, and I'm appalled to hear that actual emergency management team members are not aware of and presumably not getting and presumably not even on the Town Announce mailing list. I mean,
I think it was specifically the Board of Health announcements that they wanted.
Oh.
Yeah.
Oh, but if they're on Town Announce, they're getting our public messages. Right, and you can sign up to get notification of what's going to happen of the meeting agendas. That's a different thing from Town Announce. Right, and so actually, I'm not sure why most people would sign up for that unless they really want to know what the Board of Health agenda is going to be.
Right. Well, what we did talk about, Kat, was the fact that probably the town needed to do a better job or let people know on a regular basis how you sign up for Town Announce and just reminding people. So Grace was going to follow up on that, and someone was going to, I think, write something for the newsletter about how to sign up for Town Announce. And I think Grace did say, I took down the numbers, there are only 300 or 400 families in town on town announce.
So that's
300 or
we-
400 households.
right. And we have between 800 and 900 households in town, right?
Yeah.
So less than half. Right. And some of those people aren't on the internet, and that's why not. And some people don't care, apparently. I mean, every time something goes out in writing, I put that on it.
Okay,
Sign up
good.
for this. And I'll put it on this one again, even if Grace is going to do it.
Well, I think it's a
but-
good one. Grace is going to do something about how to get on town announce.
I
So,
do that too. I do that
Oh,
too.
you
It's the
do? Oh, you
easiest-
do?
It's
Okay.
the
Yeah,
easiest
yeah.
damn thing in the world. And I
Yeah.
mention it every time I get the chance. Maybe it would be smart. I'll talk to Grace about that. About putting some signs up,
Yeah.
physical signs, say at the post office, the library. I'm not sure where else.
School.
Well, we could get into the school weekly newsletter that goes home with the kids on Friday afternoon.
Right.
And that would probably be smart, and try to get more people in there. I mean, I always say the same thing: sign up. You're only going to get 1 or 2 emails a week. Most of them are going to come from me. And I tell them exactly where to go on the web page to find it.
Well,
But
you
it
can
doesn't-
lead. You can lead a horse to water.
Well, ain't that the truth? But maybe some signs up. And I think that in the last newsletter, I said, if this isn't an option for you, you don't have internet, or you don't want internet or whatever, call us, right? But nobody's called and said, I'd love to get your messages somehow, but I'm not on the internet. Right. So more leading to water.
Yes.
That reminds me, could I digress here for a minute? I happened to have a conversation with a town resident a few days ago, and this person has sort of long-term Lyme disease, and she claims she's running at about 25% of her normal weight. She's an older person. She's got an adult child living with her, and that child has Lyme also, and she says she's maybe even worse off, and has trouble keeping track of things and remembering things and so on. And I don't know, I didn't want to go prying about this, but I don't know if this person is getting any kind of services, and I'm not sure what our role is, if any, in facilitating that kind of thing. Anybody have any thoughts about that?
Afraid not.
Yeah, me either. I don't know what services other than, your own personal physician. You mean just making available to them what some, I don't know. I don't even know what the resources would be.
Yeah, I don't either, really, but it seems like this person is kind of floundering in her life and her home, and I don't know if there's any kind of help available for such a person.
It
Maybe
might
I'll
be
talk-
age related. Is she old enough to qualify for elder services?
I
She's
think
certainly
so.
not debilitated enough for hospice care.
No, she's not, but she is old. I believe she's older than I am. I'm pretty sure she is.
Not that.
That could be
Nobody's
40.
that old.
Well, I might be.
Do they participate with village neighbors?
I have no idea. I just don't know anything about it. I mean, we were talking about a kind of focused thing, and
Mhm.
I wasn't asking her questions about her
Yeah.
whole living
Mhm.
situation. She just volunteered things. Maybe
Yeah,
what
I
I'll
mean,
do is talk with
their
somebody on
healthcare
the
provider
council on
could
aging.
make a referral to, but their healthcare provider could make a referral to a visiting nurse association
Mhm.
and get some home services set up, but that does have to come from, there has to be a referral,
Uh-huh.
as far as I know.
I think what I'll do is I'll talk to somebody on the Council on Aging and just
Mhm.
ask them what happens in a case like this and see if there's some way we can
Yeah.
connect the dots. Okay, so back to the newsletter. There's the whole question of people, what's the actual content? I mean, we do want to say, get on Town Announce so you can get all of our messages, but what other content do we want to have in here?
And I think Grace is planning an insert to the newsletter that will accomplish the Town Announce piece. But I would like to see communications about reporting self-testing to Arlene, and a communication about at least the federal program to receive in-home test kits.
Okay, I'm sorry, would you say the first thing again?
So the first thing I said was that Grace is going to do an insert about.
No, that I got, the two things that you wanted to put in.
And so Arlene's point about self-reporting
All right,
to her in-home testing.
If it's positive, they don't have to tell me about negatives, please.
Right.
they may want to brag about that though.
Yeah.
But maybe the lead into that would be something around the availability of the federal program to have direct shipment of per household of 4 test kits and the web address for that.
Is there also a phone number for that?
That's a good question. I would imagine that I do think that they have some sort of a hotline.
Okay, I'll find it. Okay. Right, as far as talking about the current situation, we have to get these things in so far from the moment that probably nothing else, and I like to say that, right, that, if we want for up-to-date information, you can get our messages, you can see our website, you can call us if you have to. But it changes minute to minute. Perhaps we should give some mask guidance, since now it's all about 95s and not cloth masks.
Yeah.
Do you think that would be helpful?
I think so. People may not know, if they're not up on current events, that with Omicron's transmissibility, it really is recommended to use a mask in the 95 family, whether that's N or KN. And apparently there's one other, I forget the designation, one other 95, but you might want to refer them to, there was a really good article I just read on how to identify counterfeit masks and how to get a real one. So if they're going to invest time and money in buying masks, they don't want to get one that is not the real thing.
Uh-huh.
The other reason for emphasizing or providing some mask guidance is that as of the end of December, both the CDC and the DPH changed the guidance around isolation and quarantine. And there's a much heavier reliance on masking in the new guidance. The new guidance calls for a COVID positive person to isolate for 5 days, not 10. And that is not because nobody is infectious after 5 days. Some people are, but the vast majority are no longer contagious. And the DPA, DC are trying to strike the explanation of why this change was made. And the upshot is, first of all, when the guidance was 10 full days of isolation, a significant percentage of people were just not doing that. And so they were exiting on their own prior to 10 days and not taking any further precautions. The data shows that most people's contagiousness is in that first week since symptom onset. And so by the end of 5 days, there is a much reduced level of contagiousness. So to let people out of strict isolation on day 6 is not, it is not risk elimination, it is risk reduction. The advice is, okay, leave your house on day 6, but mask with an N95 type mask 100% of the time that you are around other people.
Okay.
And so they're trying to strike this balance between the infectivity and the impact of a 10-day isolation on people's lives, you know, and livelihoods.
Okay.
So it is now a 5-day strict isolation. At the end of 5 days, if you are fever-free and your other symptoms are either resolved or very significantly improved, you can leave strict isolation on day 6. Mask 100% of the time around other people, all the way
How
to
long?
the end of day 10.
Okay. Okay, that seems like a good general thing that we could put in.
Yeah, so it is it's an emphasis on the masking for to make this successful. It's an emphasis on masking, and masking within the household is also emphasized. A lot of people think, all right, I'll mask when I leave the house, but they don't all remember to mask around their family members.
Right.
And if they have been positive and others in the household have not, it is still really important to mask 100% of the time, even around household members, until they have passed 10 days.
Okay.
That's because the vast majority of the transmission is within the household.
Oh, vast majority. I think every case that I have investigated, you know, you can't always identify where a person picked it up, but it appears to have been household acquired.
Right.
Yeah.
And
Okay.
and the
I don't
current
know if that's
estimate
every case,
is,
but almost every case.
yeah, that's right.
Yeah.
We see whole families. So
Yeah.
the
And
the
if not
current,
within their household, then it was holiday gatherings with extended family is I mean, that's why we've had this big surge in this last month, is
Right.
all of the holiday gatherings that happened. And that's why it's dying down now too, that time has passed. But I think almost every case that I investigated, there was some sort of a immediate family or, you know, friends and family gatherings over the holidays where it was transmitted, not workplace stuff, not school stuff, not, you know, super spreader event kind of stuff.
Okay. So it sounds like we have a lot to say for this one.
Yeah.
Okay, I will write something up, probably not tonight, but probably tomorrow. We're supposed to submit it on Friday.
Yeah. Okay.
So I will certainly send it around to you guys for comment and improvement.
cool.
Okay, thank you.
Let's see. So speaking of masks, Should we be buying some? Now, we were talking about buying masks and we were talking about buying tests. And it seems like the whole test question has been obviated by the federal program of providing them by mail and the insurance coverage of the masks now.
Yeah, things
the
change
tests.
so quickly. Yeah.
I know it. We've just been a step behind on everything, and that's not really our fault. So presumably we don't need to buy any tests. That seems not a good use of money. But what about masks? Is that a possible thing to buy masks?
Pat, if we could come back to tests just real briefly, because at the emergency planning team meeting, it did sound as if an administrator was looking at the possibility of tests, but that the minimum purchase threshold was so high, like we're talking pallets, that it maybe didn't make sense. So I don't know if we need to close the loop with her.
With Becky?
Yeah, with Becky.
Okay. Yeah. Well, we probably should. I know that the minimum purchases directly from manufacturers were really high, but I thought that the minimums with distributors were lower. But I think it's a moot point. We don't need tests.
Yeah, through the state purchasing program, there's like 3 vendors, and the number of tests that you have to buy is crazy unless you're going to partner with neighboring communities. And
Yeah.
now the federal government is purchasing a bazillion of them.
Right, they're going to buy up all the
I don't know
stock
that
anyway.
Right.
Okay. Well, since there's really no need for it, we just won't worry about that. But what about masks? Wim, have you been looking at that or only at tests?
No, I only looked at the state vendor list for tests.
Okay.
But masks, there are far more manufacturers and distributors for masks. Is there a state list of approved participants for masks?
Not in the way that there is for tests.
All right.
That I'm aware of. Now Walter Tibbetts did mention that he has a supply of I think N95 as opposed to KN95, and that he could conceivably also approach MEMA to see if they had an allocation that they could give the town.
If we could lay hands on some masks, how might we go about distributing them? But wait, before we even think about that, let me ask you guys another question. How long do we imagine that this sort of greater masking necessity is going to be before us? I mean, are we going to spend a few weeks laying hands on masks and then a week after that, we're not going to need these 95 style masks? Or
I don't think that's in the cards. I think the recommendation for masks will continue far beyond sort of the flash and burn of the Omicron. That's going to die out quicker, but I think people will still be, the recommendation will still be to continue to be masked. Don't you think so, Arlene?
I agree.
Okay. So it makes sense if we want to encourage this. It could make sense for us to buy and distribute some masks.
Yeah, I would think so, because many places they're mandated now, and to have put that into effect is not something that they're going to reverse really quickly.
Right. Okay. I just wanted to make sure we weren't on another fool's errand there.
No guarantees, but
Yeah.
if they're not needed in the next 3 months, and I wouldn't be surprised if next winter, you know,
Okay.
the phrase I was looking for.
Or-
Thank you.
I just realized I've been invisible all this
Here's
time.
its ugly masked head.
That's
Exactly.
right.
Ooh, love
Reverse
it.
it's right.
Right.
Right. So how might we go about this?
Well, I'm more than happy to look at sourcing. I mean, I work for a public agency. I can see where they got their stockpile because 95s are mandated where I work.
Right.
So that would be easy to look into.
Okay.
And it may lead me to other sources. I don't know that there's a state website like there was for the testing.
Right.
If I may, here's a place where FERCog might be helpful too. I mean, they accessed, if I'm not mistaken, masks for all the vaccine clinics that were held, and at least the ones that I volunteered at, there were KN95s provided to all of the volunteers. So they must have a handle on some sources as well.
Okay.
We shouldn't have to reinvent a wheel and figure this out ourselves.
Okay. Noreen, do you think you could follow up with FERCog?
Oh, Noreen, you're muted. You're
No,
muted.
I thought she was boycotting me there.
Yeah, well, I was trying to, Kat, to tell you the truth. Of course, I can follow up with FERCog.
Perfect.
That
And
would be really
I
good.
think one of the things I would advocate if we're going to purchase new masks is that we work with Chief Tibbetts to determine the
Yeah.
shelf life on what he has. And if what we purchase is, has a longer expiration date than what he has, that we
could switch. Yeah.
Right.
rotate.
Yeah.
Right. Rotate the
We
stock,
also,
yeah.
he does have a vendor now, so we also might be able to use his vendor again, and he knows what kinds of A95s MEMA or whoever
Yeah.
provided to them. So, I mean, he's another good source of information.
Yeah.
Well, if we dilly-dally here long enough, we might see him tonight because he's hoping to come in after the cemetery commission meeting on a cemetery commission question.
Oh, good.
that he
Well,
wants to
let's
ask
do
us.
that.
Oh, okay.
So
Good.
we might be able to see him. So
Okay.
so my real question here was not just how we can get them, but how we can distribute them.
Mm-hmm.
Well, I had two thoughts. I think we talked last time about just placing them at certain locations in town. That's one way. I don't know if we feel any need. I guess we just want people to get as many of them as they want. Okay, so the second method might not make sense, but we could do it kind of the way we do, the well testing. We could be open in the bottom of town hall on certain days and, hand out a certain number per family or something,
Yeah.
Yeah, I'd like to see the school nurse have a certain
Mm-hmm.
number
Right.
that she can distribute.
Well,
The
okay.
from the ones I've seen, the KN95s come in a pack of 5 or 10 per pack.
Mhm.
Well, on my recent holiday related visit with our daughter, She placed an order for us to share. It came within a couple of days from Amazon and there were 50 in
Mhm.
the package. And
And wow.
yeah,
Okay.
we brought half of that home with us and she kept half of it. So,
Mhm.
um,
Okay. Well, yeah, they seem to come in all kinds of packaging. Walter brought some to Becky for town hall employees, and those are in 4-packs.
Hmm.
So I imagine there's every possible thing.
Yeah.
So I imagine that Grace would be willing to hand them out from town hall if people would go there. Marianne would certainly be willing to hand them out at the library. The school
Right.
nurse, I'm sure, would be willing. I don't
let's
know
have
what
them
we
at
could,
the AC.
they could use them.
You got to
know
be
what?
able to stick a straw through it, though.
You know what I mean? Even if they're not going to use them there, if they take them for, some,
Right.
for when they
Yes.
leave, it couldn't hurt.
Although those are not all Shutesbury folks, but whatever.
Yeah. Right. It's good for Shutesbury if those people are wearing them at least some of the time.
Right.
Yeah, that reminds me, I was meant to ask Mark if he would keep a log of the people who came into the athletic club, and I totally forgot about it. I didn't do it.
Yeah.
But maybe I can think about it, of doing it, and also talk to him
Yeah.
about possibly having masks for people.
Yeah.
Yeah, go ahead.
No, that's right. I don't really have anything to say.
Yeah, me neither. All of this is up at the center of town. I'm trying to think if there's
Right.
a way to get it out more to the periphery.
Mm-hmm. Yep.
So if I
Um,
remember correctly, trash bags are available at the Leverett Co-op. I mean,
Ah,
Mm,
are
more than Shutesbury residents go to the co-op, but
yeah.
right.
it
Are-
would be out there.
are postal delivery people constrained by law to only deliver mail that has been stamped or metered?
Yeah.
And
Yeah, not only that, but you can't even put anything inside a mailbox unless it's
Got it.
franked mail.
Yeah.
yeah. I mean,
However, yeah, things could be put on the outside of mailboxes.
If somebody really if they really needed masks and couldn't get them and they were invited to just let us know, we could
Yeah.
troubleshoot difficult situations one by one.
Yeah.
I suspect that there wouldn't be too many people who had no other recourse but to communicate with us. But I don't think that would be an overwhelming task. Anyway,
Probably not.
I don't
yeah.
know.
I'd be happy to deliver them.
Yeah.
Me
Yeah,
too.
yeah, me too. Right. Yeah, even
Yeah,
especially like in our own neighborhoods, right?
Right.
That
Yeah.
would cover a lot of it. And I mean, we're always going places, right? If we find out there's 2 or 3 households that need masks, it's more or less on our way, we can drop them off. That wouldn't be onerous.
Or at least to tell them, let us know if you can't get any,
Right.
and we'll problem solve. Let's not commit
Right.
ourselves right off the bat to
Right.
say, oh, we will hand deliver it to you,
But
within,
yeah,
but just say, let us know and we'll see what we can
yeah,
do.
we'll
Which is
try to
kind of
help you out.
what I say to isolated people. I say, if you don't have anybody who can bring your groceries to your doorstep, or your prescription medications, or whatever, these essentials, let us know and we will try to coordinate something. And I don't know what the answer would be, but
Right.
I say it anyway.
Well, yeah, and
And other than that,
Absolutely.
a central location for pickup.
Mhm.
Yeah.
Right.
right.
could be that it's left in a bag for you at, you know, hanging on off the doorknob of town hall or something.
So
you know?
what are we thinking about numbers though?
Good question.
Well, we have
Yeah.
1,700 and change people, not all of whom are adults. And that's important because an adult mask is not appropriate for a kid, right?
Right.
But we have a total of 1,700 and let's say 50 people in town. And is it fair to say that maybe, you know, that we want to try to provide, I don't know, what, one per person, assuming that a lot of people say, no, thanks, I'm all set. But just trying to start that thinking.
Well, here's another way to think about it. How many masks would be the ideal number to give to an individual person? I mean, probably more than one.
Remember,
Yeah.
they can't be used infinitely.
Right,
That-
right.
There's and I wish I could say off the top of my head how long it's recommended that one use such a mask.
Yeah, well, it's
Yeah.
it's so dependent on how often you use it and where.
Right,
And
do
if you
you
get it
put it
dirty
on
or
for
you
15
sneeze.
minutes and take it off, or do you wear it for 8 hours? Right,
Right.
So let's just for the purposes of this exercise, let's just say 3 masks.
Okay.
So if we have 900 households, right? Isn't that what you said?
Close to
900
that,
households?
yeah.
something like that, yeah.
Yeah, it's
And
I think 850.
And if we just assume for a moment that they're not all two adult households, but let's say they are for the moment,
Mhm,
2 adults
Okay.
per household.
mhm.
So there's 1,800 people there. So, but you said there's only 1,750 total residents.
I think that's about right.
Something of
So
that,
it's
yeah.
so it's clearly not 2 adults per household.
There are many single person households in town.
Yeah. Because we have to figure adult and children masks.
Right.
There's
Right.
2 sizes.
Right.
And then also factor how they're packaged. I wouldn't be interested in trying to break up packages and
Yeah.
reapportion and all of that. You know, so
Right.
the way that the federal government approached the test kits, I think, was a good way of saying, you know, 4 test kits per household, and you know, maybe we try to factor adult size masks, children size masks, and depending on how they're packaged, a household's eligible to receive, you know, an adult and a children if they have children.
So we probably could, I mean, the data exists on how many school-age children there are, I'm sure.
Yeah, we could get that from Grace.
And if we figured 3 masks per individual, we can pretty quickly come up with the total number, adult and pediatric masks, and then we can look into vendors and how they're packaged.
Right. Because if we could get like these 4-packs, that would be fairly convenient and for,
Yeah.
for one adult.
Definitely.
Right. Okay, so too bad Grace popped in and popped out again. She's not here now, I suppose.
She is not.
No. Okay. All right. But I'll try to get that information from her tomorrow. And Meanwhile, if somebody else will do a little research about the masks and how they're packaged and where to get good ones, and also how much this will cost us,
Right.
so we can make sure we have the funds for it.
I'm happy to take a stab at that.
That would be great. And I'll talk to Grace about that, and also and I'll coordinate with her about the newsletter so that we
Is
don't
there
have.
is there a specific contact person at FERCog I should be asking for if I called them?
There is a person who's doing contracts, like supply contracts now, but I can't remember that person's name off the top of my head. So I would just say contact Tracy Rogers and she'll put you in touch. I'll send you that email
Cool.
and you can just email her and
All right.
ask who, and she'll get right back to you probably, Wim.
Great.
Yeah, she's good. Okay, that seems like everything that we need to do, but I'm still hoping that Walter will get to the end of his meeting and come to ours. I told him we were usually here until 8 or 8:30. Their
Right,
meeting
because
was-
I'm actually
ahead.
thinking Walter might be able to, tell us what A95s he has, and he might be able to get them through his vendor, and that might be the easiest way to do it. If last year he didn't have a vendor, so we had all sorts of problems trying to work through him.
Right. Yeah. Well, that would be the ideal thing. We could
Yeah,
just
it
figure
would.
out how many we need, and then we could get back to Walter and have him
Right.
order them
Right.
for us. And the other thing that he wants to talk about, he just sent me an email this afternoon, and it's about using cement vaults at the cemetery. And let me find it.
Is that a vampire preventative thing?
Yeah, right. We're very concerned about vampires, also zombies.
What is that? What's that? Yeah.
Well, here's the cemetery commission has apparently for a long time required cement vaults in the main part of the cemetery. I don't know if you know this, Wim, but they now have a natural burial section in the cemetery. And one of the provisions of that we said is that you can have a vault if you want, but it has to be open underneath so that the burial is open to the earth and to natural decomposition. But the Cemetery Commission for a long time has had a requirement that cement vaults be used. Walter says it doesn't seem to be a state requirement. And apparently, he says the question is not to ban their use, but rather should we require their use as is the practice now, or make it an option? And Walter just wanted to check with us to get our input on that. I would think that if in the natural burial section, we said it has to be open, and the main point of having it above is just for maintenance purposes so that it'll be flat and it won't hump, that my sense of it is that the Board of Health doesn't care if they have a vault or not. Does anybody else have a thought on that?
In fact, I would argue against cement vaults. I mean, it seems like an outrageous expenditure, both energy use. Cement is one of the most energy intensive manufacturing processes.
I didn't know that.
Yeah, it's hugely energy intensive.
Oh.
And you're burying it. What's the purpose? It's like,
right.
It seems absurd to me.
Well,
It's
I
not
totally
like
agree.
It's not like a corpse is leaching into the aquifer.
Right. Right.
So
Okay.
I
And-
think that's a very, very wasteful requirement as it stands.
Any other thoughts? Okay. Well, we can hope that Walter will join us soon.
Mhm.
So Pat, we did
Yes.
have a Nate Hurd, and there is an Anna Hurd here. And I don't know if they had any public comment that they wanted to bring to the board, but Nate is no longer there, but Anna Hurd is there.
Okay. Anna Hurd, do you have anything that you'd like to say to us? Welcome to the meeting. We're glad to have you. If you'd like to talk,
Thanks,
just unmute yourself and go ahead.
I felt like a little bit of an interloper, but it was really
No, not at
interesting
all.
just to sort of, it was nice to just sort of hear what the Board of Health is talking about and what they're planning and doing. We both, so obviously, maybe not obviously, Nathan and I are husband and wife.
Mhm.
And we recently moved to Shutesbury from Washington, D.C.
Oh,
And we
welcome.
both have a background. Thank you. We both have a background in global public health. We attended Harvard School of Public Health and have been working in global health for the last, I don't know, many years. And so
Uh-huh.
this is
Yeah, I
obviously
think you
of
may have
interest.
sent us an email a while back, didn't you?
Probably.
Yeah.
Um, so thank you for letting us listen in, and I think what you're doing is great. I think the idea of the newsletter and providing some additional information is really helpful. I think Nate and I have both felt a little bit confused and not sure with the CDC guidance and how to interpret some of the clauses and like the differences between what school kids do and what families do and what teams do. And I think making some clarifications for families out there so that it just becomes a little bit more clear on how they should handle positive tests or exposures to positive people who've tested positive, and the exact the exact timelines for different things. We're getting different information from school, from the hockey team, and from the CDC, and it's it's hard to parse everything out, and we're public health professionals, so
Well,
the average
right.
resident is
Imagine how
probably
the rest
struggling
of-
even
yeah.
harder.
Right. Right. Do you have
So
kids
I
in
think-
school, Hannah?
We do. We have two at Shutesbury Elementary.
Uh-huh.
So yeah, and they're doing a great job. I have to say, they're doing the pooled testing and they're doing the test and stay program and other things, but they're really good about requiring the masks and keeping kids socially distanced and
Mhm.
offering opportunities for mask breaks and all of that stuff. So it's been very helpful. And DC is blowing up, so we're like, ooh, move just in time. So.
Yeah, right. Right. So, so from your professional standpoint, do you have anything to suggest or recommend?
I mean, I think that your idea about buying some masks and making them available is really valiant. I'm not entirely sure what the best distribution strategy is. I do think that trying to target the distribution in a way that gets to residents who are most hesitant or least able to buy them. So I think, there's a lot of residents who are just buying the masks already. There are some residents that I'm sure are using material masks and just haven't fully understood how much more beneficial medical masks are. And then there's a lot of people, including myself, buying masks on Amazon and not fully understanding which ones are legitimate and which ones are not. And you mentioned the article that described the masks, and it's a pretty good one. There's like a one that has like just a database of the quality of different types of masks or different brands of masks.
Yeah, yeah.
And getting those types of information out there a little bit more. The other version of 95 mask is a KF94 from Korea, which my understanding, and I may not be totally 100% on this one, but my understanding is that the Korean KF94 regulation is just like a little bit, I don't want to say more reliable, but like the Chinese KN95s suffer from Chinese quality control, and some of them are good and some of them are not. And so it's a little bit harder because it's labeled KN95 to know whether it's actually up to the standard or not. But that list is pretty helpful. But the idea that, a handful of masks is really going to improve the situation for any one family is probably optimistic. And so unless you're providing like 15 to a family, I'm not really sure that you're making a big dent. I mean, they can wear it for a couple of days and then what do? And they have like 3 family members. And so all 3 family members wear it for a couple of days and then now they don't have a mask anymore. So I think that if you're able to provide a larger number of masks to a smaller number of people and really target the people who are either not wearing them at all or wearing material masks, is probably helpful. At the same time, I don't know how to distribute them most appropriately. I think that's very difficult. And when you're asking people to pick them up, you're probably not getting the people who are not thinking it's that important. The people that are going to come make an effort to pick them up are going to be the people who are already doing it. So it's a little bit hard.
Yeah.
Exactly.
Yeah.
Unless you have a place where a lot of people go and you could like say, hey, I have these free masks. Would you like a box?
Yeah.
When you see someone wearing a material mask.
Well, yeah, there's that, right? Let me give you a makeover on that mask. Well, what you're describing, Anna, is the Shutesbury Athletic Club, I think.
Right. I mean,
I mean, you could do that. I mean, definitely reaching out to certain businesses in the area. I think, the problem with Shutesbury is it doesn't really have a lot of
There's
businesses.
no businesses.
We don't have any, yeah.
I mean, we could also potentially partner it with other distributions. So there is the trash bag distribution. I mean, maybe it seems a little strange to distribute trash bags and masks, but
this is not the season where people are resupplying themselves with.
Right.
Yeah, not that much.
No.
I mean, I don't know how many people use the library, but I feel like the library is a pretty good resource.
Absolutely. And I know that Marianne would be happy to hand out masks.
Yeah, and I don't know if town hall, if there's a lot of visitors through there.
At the moment, town hall's closed to the public.
Yeah, and then the fire station, obviously, but I don't know how much interaction they have with general public or whether they, it's just a smaller community.
Not very much, but you're making me think that the police would be good distributors because they see a lot of people, and Kristen especially is she's very outgoing and proactive and likes to go around.
She's really great. She actually drove past us. She drove past us after we moved to our house, and we were just doing like a little trash pickup around the neighborhood because we'd noticed some littering around the Atkins Reservoir and on Cushman Road. We're just picking up some trash. She's pulled over and she's like, "Hey!"
Right. So maybe next time she would say, "Hey, can I give you guys some masks?"
Exactly.
Yeah. I mean, if anybody could get them out there and kind of target that population that you're talking about, it would be she.
Yeah, I think between her and Marianne, they might be able to to reach
Yeah.
a significant portion.
Yeah.
But yeah, I think, you know, the families who are already wearing them don't need more. I mean, they might be grateful or happy to have some more, but at the same time, the people who really need to be given the masks are the ones who are just not quite taking that extra step.
Right. So it'd be a question of how to identify them.
Yeah. I mean, obviously the easiest way to identify them is to see them not wearing the the N95.
Well, yeah, there's that. But you know, we're not having that many opportunities to see people.
Exactly.
You know, it's the
exactly.
farmer's market is closed up and hardly anybody goes to that anyway. And
Yeah.
but yeah, I mean, as far as the library goes and as far as the police go, they do see people, and they could kind
Yeah.
of help them to upgrade. How, I don't really have a good sense of this. How available are appropriate masks? Are they hard to get or are they easy to get?
I've been relatively successful in getting masks. I did realize that some of the masks that I had been getting were probably not as good as I wanted them to be. And so I recently bought a whole new slew of masks. I think the issue is that they are not cheap. And the
Right.
better ones are less cheap than the not as good ones.
Right.
So you
Right.
can
Well,
get
you get
packs
what
of
you pay
50,
for.
but I feel like the packs of 50 that cost under, you know, like $30 are really, they don't carry the same labels as the ones that are costing a little over $1 a mask. And $1 a mask doesn't sound like that much, but when you're buying 50 of them and you have a family of 4, you go through them kind of quickly.
Yeah.
So
Yeah.
you
Yeah.
probably
Especially if
spent,
you're
you
in a
know,
situation where you have to
$400
wear
on
them all
masks.
day. Wow. Yeah.
Yeah. Just,
On
you
the, on
know,
the distribution, the question of distribution, I will add that as if I have a supply of them for distribution, as I do case investigations, if I find out that a family is in need of them, I would be willing to go drop them on the doorstep of that family.
that would be a great way to get some masks out there.
Mhm.
And especially when you're doing case investigations, those are families that have an immediate need for good masks.
Right.
So
Exactly.
Right.
They certainly do.
yeah.
So we would need to estimate a little more than $1 per mask to get good ones.
Yeah, it's roughly $1 a piece.
Okay.
I mean, I think if you go through distributors that are, and you're ordering in a bigger bulk form, you might be able to get just under $1. I'm not entirely sure. I'm seeing this this website here for, it's like HRS Hughes. It's just some random website, but they're selling these 3M Aura 1870 plus masks that are N95 and rated for medical use. And they're $1.57 a piece. So
Wow.
I don't know if there's like a limit as to how many you need to buy. The cases come in 440 per case. And so I don't know if you want to buy a whole case because I don't know if they're individually wrapped or not. But the ones that I've been buying are KF94s. I think it's like Happy Life Good Day masks. It's like the brand. And they're on the list of quality masks that was put out. And I think I think it's like $20+ for like 15, something like that. So
Okay.
it's, I think the cheapest I got them for was like $1.33 per. So yeah, somewhere in that neighborhood. I think if you're buying more and you can work out with a direct distributor, you might be able to get it a little bit lower in a larger bulk situation. But this is, you know, a lot of it's like, you know, just looking at Amazon. I don't know that they're the best place to buy bulk
Right.
So,
Okay. Okay,
if
well,
you
that
can
gives
get
us
in
some
touch with
stuff to think
3M,
about.
I don't know. Yeah.
Uh-huh.
If you can get
Yeah.
in touch with 3M and buy a case of them from 3M directly, you might have more luck. I'm from
3M
Minnesota,
is,
so
yeah, 3M is definitely the
3M is close to
premium
my heart.
premium
Yeah.
priced one.
Uh-huh.
Yeah. But they're definitely high quality. They meet all of the standards that you would ever want. So, and I've seen more of them floating around. Like I see a lot of my contacts wearing 3 masks these days. So I was like, oh, people are really stepping up.
Yeah.
Yeah. But yeah, I think the US manufactured masks are much harder and more expensive to come by than the ones that are made in other countries.
Oh, interesting.
Yeah. So
Okay.
the ones that are KF94 from are a little bit cheaper. And I think there's a few that they seem to be like maybe made in India. And then obviously there's a whole slew of them made in China. But again, with the Chinese regulations, you have to be a little bit more careful about which ones you're buying.
Right. Hang on a second. Oh, so I see that the Biden administration is making 400 million non-surgical N95 masks available at community health centers and retail pharmacies across the US free.
Yeah, there's also a program to get them mailed to you.
That mailed to also masks also, not just tests. I knew about
wait, that was tests. That was tests. You're right.
Yeah.
Yeah, I don't know how quickly that's going to happen. The getting
Yeah.
masks to, and then again, are people going to be picking up one at a time? Or are they going to be picking up boxes?
No telling. Yeah.
Anna, can you reiterate what was the alphanumeric designation of the, I think you said it was the Korean made ones that do not have the same
KF.
KF.
So it's KF, and then it's 94 rather than 95.
Okay.
Okay.
All right.
Okay. The Times says it's going to start next week that free masks are going to become available. However, there's no indication about how many you can get or how often. Oh, there we go.
Yeah.
A limit of 3 masks per person.
So
that would help a little bit, but not a lot.
yeah, I mean, it's a pretty short-term solution. And then if you can keep going back for an additional 3 masks every few days, then that's fine. But I don't know how long that supply is going to last.
Yeah, I mean, 400 million, given the population of the United States, is not that many.
Right.
It's good, but so there would be a place for us to step into the breach. We our district, we belong to a health district with 2 other towns, and the districts received funds direct from DPH last year, and we still have a few $1,000s in it. So we have some money that we could spend.
Yeah, I think, if you can find a way to distribute it to the people who need it the most, I really do think that could be beneficial.
Yeah,
But
that's really
having
good
sort of
thinking.
a blanket distribution could be spreading your money in a way that's not as helpful.
Right. Right. Yeah, we need to give that some thought to that.
Yeah, I bet one way that you could identify families in need would be if kids show up at Shutesbury Elementary in cloth masks. I bet the rest of their family also has cloth masks.
Is that even allowed?
I don't know. Because we're well, you want the police to profile people.
Well, no, I mean, that's not what I meant at all. I meant, is it allowed for them to wear cloth masks?
Oh, I don't know whether they,
I'm trying
I
to
don't know whether
remember.
they mandate a mask type in SES yet. Do they? Arlene, do you know?
I don't think so.
Don't know if that is specified, honestly.
Well, Anna might know because she's got kids in school.
We do have kids in school. I don't remember them specifying. I know our hockey team has asked us to step it up, but the elementary school, I don't think they have I think they've maybe requested but not mandated. Or mentioned that it's a recommended. But I think that if you give them to Katie, the nurse, she would be an ideal person to target kids to send them home with masks.
No doubt.
Right, and send home ones for the adults in the family as well.
Exactly.
Right, that seems smart.
And there are youth sizes in the brand that I mentioned, as well as extra small for the little kids. And so they do have a variety of different sizes within that one brand, which I love personally. My younger kid wears the extra small and my older kid wears the youth size. And the extra small one is targeted for like 5 to 7 year olds. But in fact, my son is 10 and he fits it fits his face. So it just really depends on like what size face your kid has.
Right.
And there are special masks for toddlers, so for really small kids, but I don't specifically know which ones are the most reliable.
Okay. Wow, Anna, this
But
is really helpful.
My understanding is that for masks, even more important than the level of mask that you're wearing is the fit. And so you can N95, but if there's big gaps, it's not really helping. So making sure that people are wearing fitting masks is also something. Maybe you could put that in your newsletter as, by the way, make sure that your mask really fits you well. I'll stop now. I feel like I've talked too much.
No, not
Not
at
at
all.
all.
This is great.
Please. Yeah.
If you have any other ideas, we want to hear them. And if you're done, that's fine. But if you have more, we want to hear it.
Now
I
or
think
later. Yeah.
I think if I think of
Yes.
anything, I can write. But I think that's
Yeah.
good.
So by the way, this is an open public meeting. Anybody is allowed to sit in. So you're certainly welcome to be here anytime you want, and we would be happy to have your participation anytime.
I'll just turn on my video for 2 seconds while I say hi.
Oh, there you
so
are.
can see my
Hi.
face. Hi.
Nice to see you.
Very
Nice
nice.
to see you.
So
We really
what's,
appreciate everything tonight.
Oh,
Yeah.
absolutely.
Yeah.
So what are you and your husband doing professionally here?
We're still doing global health.
Oh, are you working from home?
Yes.
Look happy
great.
about that.
Yeah, no, it's we decided that working from home works, and our employers. Well, so Nate basically works for a contractor that works with the federal government. So he works mostly with PEPFAR, President's Emergency Plan for AIDS Relief, and they've allowed him to work from home. I think the whole COVID situation has really opened employers up to being able to do that. And I'm mostly doing freelance consulting, so it all works. Yeah,
That's great. That's great. How cool that you came here. How did you happen to come to Shutesbury?
So Nate's from Worcester, and I went to Williams College.
Oh, okay. So you guys are connected here. Yeah.
Yes, so we're familiar with the area a little bit, and we were just looking for a place that wasn't Washington, D.C., that was a little bit more slow and peaceful, less crime, but still had stuff. And
Stuff.
the Amherst area seemed like
Yeah.
a really good fit. And when we came up here and started looking at houses, we landed in Shutesbury.
Very good. Very good.
And we have internet.
Well,
We have high speed internet.
Yes.
yeah.
Yeah, and as
Right.
you can tell, it's pretty good.
Yeah.
And if you, we're actually really close to Amherst, so our address, our mailing address is one of those that says Amherst.
Oh, yeah. Yeah, yeah, you mentioned you were down by Atkins Reservoir. Yeah, you know,
Yeah.
we just got this broadband internet just in the nick of time, just before the pandemic started. Like the
Oh,
very
it's
end.
that recent.
Yeah,
Oh.
yeah.
Fall,
We just
fall
got in
of
under the wire.
2019.
Yeah,
Yeah.
yeah. A lot
Wow.
of us weren't connected until like Christmas of 2019.
Did
So-
like HughesNet or something crazy?
People
No.
did, a lot of, people did DSL, people did
Okay.
satellite internet with data caps, and yeah, there was all sorts of inadequate
Right.
stuff going on.
Right.
Well,
yeah.
in addition to the fact that you're in a giant cell phone hole,
Right,
you definitely don't need to be in a data hole.
right.
Yeah, exactly.
It's true.
We are in the complete dead zone for cell phones.
Yeah.
Almost everybody is.
Exactly.
Right.
Yeah. Yeah.
Catherine,
So we're enjoying Shutesbury. Thanks for being so
Thank you.
welcoming.
Yes.
Oh yeah, we're glad to have you here. Come to our meetings anytime. You've
Yes,
got
thanks
good
for
ideas,
joining tonight.
for sure.
Yeah, it's interesting. I'm sure, like right now, this is more interesting than usual, but
Yeah,
Got a lot to
sometimes
talk about.
sometimes it's blessedly boring, but but not tonight.
Yeah, interesting is one word that one may use.
Right.
Yeah.
So, you know, Anna, so are you guys getting the town announcements?
yes, we are. We get town
Wonderful.
announced. Yep. We get the
Okay.
library director's news. We
Uh-huh.
get the Board
Okay.
of Health alerts. Yep.
Perfect.
Okay.
And you know, there's a way, I don't know offhand how to do it, but there's a way to get the agendas. When agendas are set for committees that you're interested in, you can get the agenda automatically sent to you by email in advance.
Ooh.
So if you
Look
like
into
want to get
that.
on the yeah. I can't remember how it's done, but if you get in touch with Grace Banish, the town clerk, she'll tell you how to
I
do
think
it.
I actually remembered there's a link in like my town government.
There should be, yeah.
Website, I
There
think.
wa-
Yeah.
In
I think so.
my US mail today, there was the town annual, the update of the street listing. And everyone probably is getting that, if not today, then soon. And there was an insert in there about town committee and board openings anticipated in the next year and what to do about that. So
Ah.
look for that in your mail, or
Yeah.
or follow others' advice if you don't get that mailing.
Right, but also
So-
there's a way of getting notification of what's going on.
Mhm.
We will keep our eyes open, and I'll go back to that website and see if I can find the right button.
Okay, yeah, if you can't find it, let me know and I'll find out for you.
Okay. Sounds
Okay.
Okay,
good.
great.
All right.
Okay, well, thank you, Anna. That was great.
Thank you.
and Kat, Chief Tibbetts is here.
Oh, excellent. Perfect.
Yep, hello.
Hi, Walter.
Hi.
Hi, Walter.
Sorry, a little late. I actually I never finished my cemetery commissioners meeting. We had a vehicle accident on 202 and just got back.
Mm,
I was like,
Oh.
trying to get in on this meeting and see, but yeah, so the main thing, that I wanted to talk to you guys about was the fact that it's been brought up at the cemetery commission's meetings. You know, we worked with the Board of Health a couple of years ago to do the whole green burials regulations and all that. And it's been brought up from some of the newer members why are we requiring cement vaults in the regular burial? And it's been a long-standing tradition, although in investigating it, there is no Massachusetts regulations requiring it. You know, the pros on it were it cuts down on, you know, cave-ins or, you know, settling of the graves. It does make it easier if you're digging next to a grave that doesn't have a vault, you know, you don't get cave-in or anything like that. But, you know, there was a push to kind of say, well, do we need to require it or not? It's not a Massachusetts requirement. Why are we doing it? And I said, well, before we make any, you know, judgment on that, you know, because the Board of Health was a big part in writing the green burials stuff, I wanted to just touch base with you guys and see how you feel about whether we in the main part of the cemetery require the cement vaults or not. You know, I know there's a big push to get rid of it because it's putting cement and steel and stuff into the ground. It's not supposed to be there, but you know, it has its pros and its cons. So I just wanted to get your guys' feedback from it, if you will.
Well,
Is
we
that
talked about
why-
it a little bit. Go ahead, Wim.
I was gonna ask, is that why when you see movies or pictures of grave sites, there's a mound? Is that to account for some collapse of a casket?
In some of the, yeah, in the old style of, you know, before we got into embalming and all that other stuff, yes, you know, they made the mounds because it does collapse in. They do that even, I think, at some of the, a little bit in the Jewish cemetery here in town. We've really kind of talked about that with the company that does the, you know, digs our graves for the green burial, is how much do you mound them? You know, we didn't want to mound them too much because then, you know, taking care of them, if it doesn't collapse that much, then you have a mound, it's hard to mow over. It's a lot easier as it settles to just keep adding some dirt. We've only done a couple of green burials. The one that was done in just the shroud, there's less void volume there, and there wasn't much of a collapse in that one. There was another one that was done in a you know, basically a pine box, and there was a bit more collapse with that one. The main reason for having the vaults, and it became something back in, I don't know if it's the mid 1900s, was to keep it from caving in, and then also if bodies ever needed to be exhumed, they could be exhumed and moved still within that cement vault and not worry about, you know, having the body decay and the casket decay and all that. That's a little bit of the history of it. And I was just reading some of that history today of how burials started and how it got to where we are now. A lot of it was marketing and things like that.
Yeah, for
Make money
sure.
on it and all, but you know, like I said, the main thing was when it was, hasn't been much question about it, but since we've done the green burials and then some new members on there, the question was asked, well, because we were rewriting a lot of the existing regulations, because some of them were very outdated and there were some things that weren't covered there that needed to be, that was brought up about the requirement of the cement vaults. And I should have asked you guys this a while ago. It's just one of those things I just forgot to do. And I was like, oh yeah, I got to do that. So I wrote the email to the board, and Catherine wrote me back or emailed me back, said, well, we're meeting tonight if you want to jump in. So we could just discuss it a little bit.
Well, and we had time to talk about it, so I read that part of your email, and we talked about it, and our feeling about it is we don't have any reason why we think you should require them. And indeed, Wim made a passionate speech against using cement underground because of its high energy requirements. So I think that in general, we would be perfectly content for you to not require it.
Okay. All right. That's good to get the feedback, and you know, we'll bring it to our next meeting. We were going to talk about it tonight, but like I said, I don't even know if they got that far on that or not.
Right.
I had to leave pretty close to the beginning of the meeting. And they probably were just waiting to hear back my report back from you guys.
Right.
So I think what we
yeah.
will, what I'll propose to them is that, we won't require them, but we're not going to necessarily
Prohibit them.
prohibit. Yeah, we're not going to prohibit them. And it will leave it up to the people and, working with the funeral directors on the regular burials. I mean, obviously in the green burials section, we're not using them, although if somebody does choose to use them, they have to use the vault without a bottom. So it's still
Right.
the natural process. That would just help keep from some caving in the future. But, I just wanted to get your feedback on it in the regular part of the cemetery. It's just been industry standard, if you will, for the lack of a better term, for so many years. That when it was brought up to me, it's like, I don't know. It's always been or for quite a long time, been a requirement in the cemetery. Started looking into it and find out there is no Massachusetts regulations. There's no federal regulations on requiring a vault. Like I said, just because you guys were so involved in writing the green burials and, the process for doing home burial cemeteries, I just wanted to run it by you and get your feedback.
Cool. Well, we had something we wanted to run by you also. And so we were glad that you were coming in, and maybe somebody else will talk about this. We are thinking about getting some masks. Good mask for distribution throughout town.
Yeah, I caught kind of the end of that conversation there.
Noreen, you mentioned that maybe we could use Walter's vendor, or.
Well, two things, Walter. I was wondering if you had recommendations on masks that you thought were particularly good ones, or ones that MEMA had chosen to supply you guys with. And the second question was, I think you do have a vendor now, and, would it be possible to use your vendor contract to purchase some?
Yeah, I don't see why it'd be any problem to use the vendor contract. As it stands for things like masks and all that, we have received everything that we've been using that we got through MEMA. We have not actually purchased any masks at all. At one point, we had probably close to 4,000 different masks. Some of them are the KN95. Many of them were just the surgical masks, surgical procedure masks, which, for a while were okay, but now, with Omicron is definitely, not rated as the best. Some of the problems I did catch in your discussion, some of the problems with the first masks that came in when the supply chain was starting to open up, was a lot of the masks were coming from, or most of them were coming from China. And although they were saying they were N95, they started doing testing on them, and some of them weren't even equivalent to a 35 mask. Millions of them were sent back because they were basically no better than a piece of cotton across your face. Even though they said N95. So, the standard of testing was pretty low. And they started doing a lot of testing of the mask, random testing to get that standard back up. The last that we have been getting from them, or had gotten, were, meeting the standards for the N95 or KN95. I'm not exactly sure how many we have left of those.
What I'm wondering, Walter, is could you just shoot one of us, maybe Wim, I don't know, or you could shoot it to me if you don't have Wim's email, which ones you're recommending now that you guys are finding fit well and are effective?
Okay, I mean, basically we've been using, well, I will tell you for the department ourselves, one of our members who had a commercial sewing machine, he got a hold of some N99 filter material, and he was making masks for us. So they were, at first he made a double layer, which were extremely efficient, hard to breathe through. We switched to the single layer N99 material, and they fit very well. They were good. They're washable. were, reused several times. We still have some of those, but then we have been using the KN95s that we got from MEMA for the most part now, because we are requiring them anytime there's more than one person in the station, we're requiring use of masks. We're using them during training on all the calls and everything else at this point. But we've just been using what we got from MEMA. We haven't purchased any in the last year and a half or so, I think.
Well, I think
those-
that's
those
all.
are the-
Go
Go
ahead.
ahead.
I think that's all we're asking, Walter, is which ones are you using that you believe are effective that we might consider purchasing for town residents to give out to town residents?
Okay, I'll look into who the manufacturer is. I think it was some, off-brand name made in China, but I'll see what there is, and I'll see what MEMA has.
Okay.
They were asking a little while ago if there's anything we really needed, and at that point, we were really just kind of short on gloves a little bit. I can put in a request and see if we can get anything from them, because anything that comes from them is at no cost. So if we can get, even 1,500 or 2,000 or 3,000 masks for nothing, that would go a long ways towards, helping you guys out too.
Yeah,
Yeah.
that'd be great.
That would be great.
All right, I'll try to contact them tomorrow. Let me write that down now. And see if there is anything available in the way of masks in their stockpile.
Okay, and secondly, if there isn't, just if you would let us know again what you are using that you would recommend would be good to hand out to residents.
Okay.
And we could order some of those, or maybe can we use your vendor to order some of those?
Yeah, we haven't ordered anything from this vendor for a while, so I mean, we still have the account with them and all that.
Yep.
I can check in and see what they have for masks too. I can make a call tomorrow.
Okay, that would
See what
really
is
help
available.
us out.
We get a lot of advertisements from different companies saying, oh, we've got all these masks in stock. We got all these masks in stock. Some of those are, quality vendors. Some of those are, kind of fly by night outfits where they get you to order a whole bunch, minimum order is, $5,000 worth of masks, and then they take their money and then you never get your mask. So you do have to be careful of. There's been a lot of those scams going around.
Right, and we thought you guys probably had more experience with that than we did. So any help you could give us, we appreciate.
Right.
Yep, I can do that. There's one that's been sending some stuff around. They seem fairly reputable. We haven't really needed the masks yet. So we haven't been ordering them. But I will check on that and see what we have available and get back to you on that.
Great, thank you.
Sure.
Anna, are you still here?
I am.
Walter, we have somebody on the meeting tonight, Anna Hurd. I don't know if you've met her yet. She's new in town. She and her husband are both professionals in global public health.
Oh, great.
So
Yes,
we
sir.
plan to tap them frequently as great resources.
Excellent. Well, nice to meet
Yeah. To be here. Yeah. Nice to meet you.
They're refugees from Washington, D.C.
you. Yeah. Nice city. It really is, but not for a time like this.
Yeah, right. They were doing okay for a little while, but apparently it just blew up pretty massively. And then the school system also had like a really hard time coping. So we got out just at the right time.
Good for you. Say, Anna, can you send me that list of masks that you were talking about? Can you send that to the Board of Health? Do you have that?
Yes,
or a
I think
link to it
I
or something?
downloaded it. Yeah.
That would be great if we had that, so we'll just be in the loop. Okay, are we done with this meeting? Is there anything else that we have to do or say?
Good night is all.
Okay, do I hear a motion to adjourn?
Move to adjourn.
Second.
Okay, all in favor?
I think
Aye.
Arlene had something to
Yes.
say, but she was
Yeah,
muted.
it can be off the record though, and it's
Okay.
just about my own availability. I just
Mhm.
wanted to let everyone know, I was speaking briefly with Noreen about half of this today, but for the first, last few days of April, first, let's say 12 days of May, I'm gonna be gone and completely not available because I will be out of the US, COVID permitting.
Oh, wow.
And then from the 31st of May through about mid-June, I am going to be unreliably reachable. So we need to plan soon for coverage here in town. And we don't need to do anything tonight, but I just wanted to let you all know that,
Coverage for your contact tracing work?
yeah, and any reportable disease stuff.
Okay.
We need to either rely on someone out of town who's a Maven user or bring one of you all on board in Maven and get you up to speed on that.
Weren't you talking about getting Wim on that?
Well,
Yeah.
Wim and I were talking about it and but I didn't at that time have any knowledge about my planning to be away, but now unless COVID cancels this, either or both of these out, yeah, there's stretches of time. So we may, if you're still willing, Wim, we may want to onboard you. Okay,
That's okay.
all right.
You and I will have to, from now on, we'll have to coordinate our vacations though.
Right. That's right. Okay,
Good.
Okay,
that's all I
good
have.
to know.
Okay,
Okay, let's call it a night.
All right.
all right.
Let's
Good
do
night.
it. Night, everyone.
Okay.
Good night, everyone.
Good night, all.